I've been in healthcare 40 years or more, and on both sides. I was a CNA when I first started. Then I became EMS about 18 years old. I'm an instructor in everything. I teach AHA classes, CPR, ACLS, BLS, PALS. I'm also a NAEMT training center, which we teach PHTLS, GYMS, AMLS. But in 2020, when COVID first hit, I decided, okay, we need some EMTs out there.
So due to the EMT shortage, it's been a great process to see them turn into paramedics or go into the paramedic role. We produce qualified EMTs. They are not robots. They do have compassion and understanding of everyday skills and life settings. We try to give as best roles as we can and moulage the patients up as they understand this is real life versus what the book just says.
With the students and the way we do the skills, we lay everything out. We divide them into groups. I have EMT adjuncts that come in. Some of them are paramedics. Some of them are EMTs. Some of them are past students. They come in and do the hands-on skills. We work with the leg splints, the CPR skill, the arm sling and swath for the arms. We do CPR. We've got the touch screen monitors for them to be able to use during those classes. We use what's called VR patients. When our current EMTs pass the hands-on patient assessments, we let them play with the VR headsets and do patient assessments with the VR headsets. So I make sure my EMTs are confident when they walk out of here.
Before me being an EMT, I was an HVAC technician. So I knew nothing about learning how to take care of people. I knew nothing about oxygen tanks or a pocket mask or a bag valve mask. And she really did help with learning how to use that, learning how to apply a C-collar too. It's not easy, but she definitely helped with that.
At first, I didn't know anything about saving a life the correct way. So after doing this training, I learned multiple ways how to control bleeding, trauma to the head, anything, overdosing, all the different medications and different things there is to save a life.
With all the skills practice and all the extra equipment that we have here, as far as like the touchscreens, the VRs, the hands-on, they're prepared for just about anything you can throw at them the first day of work.
Before I was interested in taking a course, I was kind of skeptical because the course lasts 4 months. So I was like, how am I going to be prepared to be, a certified EMT in 4 months? But being here and learning the hands-on training and going through all the books and stuff and getting all the right materials to help us prepare for the test, I feel confident enough that I could be certified.
I'm really enjoying Sylvia's EMT course. I feel way more confident in being able to help patients that are in need with CPR training, learning how to turn on the oxygen tank and how that works. We're learning a lot that, that'll help save people's lives, and that means a lot to me.
Ever since we started this program, we've put out quality EMTs that's out in the community now working. And it makes me feel great knowing that I'm one of the ones responsible for putting quality EMTs out on the streets or in the plasma places, maybe the ERs or the urgent cares, wherever they're working. Those places are getting quality EMTs that really care about their jobs.